Tonight, we are discussing lymphoma, a type of blood cancer where some blood cells are in a state of uncontrolled growth. In 2012, there were 80,000 new cases reported with about 20,000 deaths. We will hear from Dr. Tim Kazanick from Toledo Clinic Cancer Center. Find out more about the Leukemia and Lymphoma Society. Talk with a 7-year survivor of non-Hodgkin lymphoma. And it was my great pleasure to talk with Mary Beth Zolic from 101.5 The River. She has a great news about her battle with lymphoma. That's next on Time Waits for No One. Welcome back. There are two primary types of lymphocyte in our blood, B cells and T cells, both designed to recognize and destroy infections and abnormal cells. Lymphoma occurs when lymphocyte B or T cells transform and begin growing and multiplying without control, collecting in our lymph nodes and tissue and eventually form a mass of cells called the tumor, which could grow and invade the spaces and surrounding organs, depriving them of oxygen and nutrition. If abnormal lymphocytes travel from one lymph node to another and then to another organ, the cancer spread or metastasize.
Lymphoma is a type of cancer that begins in white blood cells called lymphocytes. Lymphocytes are the main part of our immune system and circulate in blood vessels, as well as in their own network of vessels and lymph nodes. From there, they can enter the blood or tissues to respond to bacteria and viruses. Lymphoma develops when lymphocytes grow and divide uncontrollably into tumors, crowding out healthy tissue and organs.
There are two types of lymphomas distinguished at a microscopic level. Hodgkin lymphoma, which is mostly developed from B cells, and non-Hodgkin lymphoma with 5 subtypes derived from either B or T cells, with some of them distinguished by a unique genetic markers. What causes lymphoma? There are no identifiable cause, but some scientists identified several potential risk factors. Genetic. It's possible to be born with a genetic fault that increases statistically the chance to develop lymphoma. Carcinogens. They are substances responsible for damaging our DNA, promoting cancer, such as exposure to specific materials, for example, black hair dye, benzene. Also, other medical factors to increase the risk of lymphoma, like our age. The older we get, the higher the chance we have possible non-Hodgkin lymphoma. Medical conditions like HIV, Epstein-Barr virus, Helicobacter pylori, hepatitis B or C, autoimmune disease like lupus. And lastly, in 2012, Stanford University scientific team identified some newer risk factors, including old maternal age and low birth weight. What are the symptoms of lymphoma? It depends on where the cancer started or spread. The symptoms varied, usually present with a swelling in the neck, underarm, groin, or other organs like the spleen. These will lead to different types of symptoms like pain, swelling, numbness, and many others. Some non-specific symptoms such as fever, chills, unexplained weight loss, night sweat, and itching also was reported. And it's my pleasure to welcome to the show Tim Kazanick. Dr. Kazanick is well known in town as an oncologist. At the same time, he is one of the main physicians who is working in hematology oncology in the Toledo Clinic. Welcome, Tim.
Thank you, Mary. Nice to be here.
Thank you. Concentrating today on non-Hodgkin lymphoma, we want to educate the public about the basic of that disease. And the first thing I want to ask you is, how can you define non-Hodgkin lymphoma? How can we describe it? What is it?
Well, lymphoma, all lymphomas, and non-Hodgkin specifically, is a cancer of the lymph nodes. The lymph nodes are part of our immune system, and so we know that when we're kids, we feel them underneath the jaw, around the neck, but they're under our arms, all throughout our body, and they're part of our immune system. They help us fight off infections. Unfortunately, just like anything in the body, they can become involved with cancer. And so lymphoma is a cancer of this lymph node system.
And what is the most common symptoms the patient will feel at the beginning, other than the lymph nodes enlargement, which is probably common signs?
Well, you're right, that is the most common, but second to that, some people can develop what we call B symptoms, and those could be night sweats, weight loss, fevers and chills. However, those are common with a lot of other more common things. Sure. People with a cold or a flu can have those same symptoms. So I caution people, if they develop those things, not to think that they have lymphoma. It's probably something else. But it's something to bring attention to their doctor.
So in reality, when the patient feels something unusual, they should check with their doctors. And their family doctor probably is the first line of management, or I always call them the captain in managing the patient problem. So in your opinion, what are the first diagnostic tool which is the family physician pursue and then decide to send it to you as a specialist in this disease?
Well, often the family doctor will find a lymph node, an enlarged lymph node on exam. And a lymph node can be there for any type of infectious reason. If someone has a sore throat, they may have an enlarged lymph node. But if the lymph node persists and doesn't go away or gets larger over time or more appear, then the family doctor may say, well, we need to work this up further. Sometimes the first step is a biopsy of that lymph node to find out exactly what it is. Other times the patient may have more non-specific symptoms, and so some type of imaging test may be warranted in order to determine or help determine what's going on.
What are the most common imaging testing which should be done as a diagnostic tool?
Well, once we know the diagnosis of lymphoma, then we do what's called a PET scan to take a look at the whole body to see what looks like lymphoma and what doesn't. So what does a PET scan do? PET scan is combined with a CAT scan, whereas the CAT scan will sort of slice the patient up virtually to take a look at every part of the body. A PET scan uses a dye that's attached to glucose or a sugar molecule, and it'll show us areas of increased activity. Now, that's not necessarily cancer. It could be infection or inflammation, but it also helps us show us where lymphoma or malignancy may be in a body.
How to diagnose and stage lymphoma? Patients usually are the first one who are to observe abnormal signs, which is the most important step for early diagnosis, leading to earlier treatment and better chance of recovery. Report all of your abnormal findings to your primary care physician to follow up on those abnormalities. Physical exam and history taking is so crucial by your family doctor. Blood tests to check on blood counts, kidney function, and liver performance are similarly important. Chemicals called lactate hydrogenase, LDH, is found to be in a higher level than usual in some non-Hodgkin lymphoma. Imaging techniques are used to see where the cancer exists and how far it's spread. That include X-rays, CT scan, MRI, PET scan, and lymphoangiogram. Sometimes diagnoses require bone marrow biopsy. The best way to make the diagnosis is removal of a small sample of the tumor and look at it under the microscope. And that can be done by a needle or small surgical biopsy. After the diagnosis is made, identifying the type of lymphoma and staging the lymphoma will be crucial for treatment, and that usually done by a specialist oncologist.
You'll remember this day forever. You'll remember where you were. This day has never been closer. Today, thanks to the Leukemia and Lymphoma Society, hundreds of thousands with blood cancer are living a normal life. We've spent nearly $1 billion on cancer treatments, once thought impossible. We're almost there, but we need your help. Help us make cures happen. Help us reach today sooner. Join us.
Today it's my pleasure to welcome Mary Beth Zolic. Everyone knows Mary. She's on the radio station. She talked to us every day in the morning, and it's my pleasure to introduce her today, where she wants to do public education and public awareness about one of the diseases which she experienced herself. At the same time, there's a lot of people who experience that disease. Mary Beth, thank you for coming.
My pleasure, absolutely.
Tell me why you want to do this.
Well, because about 4 months ago, I had a terrifying experience when you go into the doctor and they say you need a biopsy. We think we see something going on with the lymph nodes, and I was feeling perfectly fine. No symptoms, no anything. I'm thinking, it's not possible my body could betray me. I know my body and it's all good. Well, it wasn't. They did a biopsy and determined that I had non-Hodgkin's lymphoma in 3 different areas of my body, and I was going to have to undergo chemotherapy.
How did you receive that news?
Well, at first, you know, disbelief. I was like, are you sure we can't do something? There has to be a mistake. I don't feel anything. I'm not having night sweats. I'm not fatigued. I don't feel any, you know, growths at all in my neck, so it can't be. And then when, you know, they show you your CAT scan and they show you things look differently in 2 different CAT scans, something unusual is happening in the second one, then it's, okay, what is it? What's my prognosis, number 1?
Sure.
And what do we do? How can we go after it now and fight it?
Okay. Now, I always concentrate on the relationship between the patients and the physician. And because I always believe that if the patient received the information and improve his knowledge about the disease, that probably by itself is a 50% of the management and treatment. Did you feel that way?
Couldn't agree more. Because prior to going in to talking to my oncologist, Dr. Kasnick, everything I had done was Google or WebMD. And I know we're not supposed to do that, but immediately I'm looking it up and thinking, wow, I have no idea here what my prognosis is, whether this is something I should be up nights worrying about. And until I actually went in and had my first appointment with him, and he came in very positive. He said, we're going to beat this. This is, sometimes I have to come in and tell patients not great news. Today isn't that day. Your news is very positive, and we've got just the treatment for you, the course of treatment. It's worked successfully with other patients. He made all the difference in the world in terms of where my mindset was about what I had and what we were going to do to deal with it and what the future looked like.
But also I want to mention the role of the patient himself. I have no doubt you mentioned something like you Googled everything. That means you were prepared to ask the question. And that's where the most important thing, the patient should ask the question. The physician, sometimes we miss telling the patients all of the information. So if you don't ask that question, probably you will not get the answer. So always feel free to ask as many questions, and I assume that's what you did.
That's what my husband was my advocate for health, because he actually pays attention when we go into the meetings. I'm a little more, you know, thinking about, well, what's next? Have I done everything correctly? We wrote down things, both of us, and went in with questions and made sure we went through all the questions before we left the office.
And how do you feel right now about your prognosis now? You got some of the treatment, you are moving forward?
Yes, I've had 4 chemotherapies. I got a PET scan result recently that said I've had a complete positive response to the chemo. So I still have to undergo the other 2.
Sure.
As I tell people, it's like you have to finish an antibiotic. You have to finish the course of treatment. And I know that, you know, you're not cured till after you've been clean for 5 years, but this is the most positive first step in that path. So I'm very excited, very positive, and let's just get at it. Let's do it.
Dr. Kasnick mentioned that you have a blog right now for non-Hodgkin lymphoma. You want to tell us something about it?
If you go to 1015theriver.com and click on Mary Beth and Rick, you'll see a big sign that says Mary Beth's Journey. And if you click on that, I tell everything. I was recently in the hospital for 4 days. I tell all about that, and I don't hold anything back because it's a blog. If you don't want to know it, then don't read it. But I also tell the funny stuff, and I try to share as much of the humor as I can, because there is a lot of humor in things that happen with the body and those kind of things. But I also tell the emotional roller coaster that I've been on, and I find that people who have the same illness as me, will send me an email or a text right away saying, oh, you know, we're really good about sharing information, just simple things. I haven't been able to find a refreshing drink to drink. Water just doesn't taste right to me. Immediately I got information from people, try this, this worked for me. So it's been a very give and take. Not only is it therapeutic and cathartic for me to get the information out there and my feelings out there, other people have been so helpful in suggesting things.
Did you have any feeling at any minute that what you had from this disease, non-Hodgkin lymphoma, limiting you to be on air, or you have to cut down? I hope not.
No, there have been days I couldn't go in because it would be right after the chemo, and either I was exhausted or just not feeling up to it. But you know, one of the things I heard from a lot of people is if you can keep your normalcy as much as you can, your regular routine, do it. And I find work to be a great distraction. Just if I can go to work, I go to work. In fact, people at work are always saying to me, how are you feeling? How are you doing? I say, if I'm here, I'm feeling good. The only reason I wouldn't be here is because I might not be feeling good. So it's been very, very beneficial.
Toward the end, what is the message you want to give it to the general public?
Oh, so many things that I've learned. First of all, I've learned about how to treat other people when they are going through something, because before I might have been one of those people who was hesitant about saying, how are you doing? I've learned that, and there's a great quote that my husband found that said, be kinder than usual to everyone, because everyone is going through some sort of a challenge, whatever it could be. So I've learned that about myself, that I now know how to treat people differently than I did before. The other thing is, you just can't say enough what a positive attitude means to helping in your treatment, and always thinking, what can we do next? If this isn't working, what's the next thing? And just the fact of people around me, good vibes, good mojo, good prayers, whatever you want to call it, are part of good medicine. Absolutely.
Absolutely, and that positive attitude is applicable not only in non-Hodgkin lymphoma, but in every disease we are treating, from the cancer to heart disease to lung disease. Definitely positive attitude toward that disease is the best way to treat yourself. Mary Beth, we wish you the best of luck.
Thank you.
And we hope always to hear you every single day for the next 50 years.
Let's do that.
Thank you for coming.
Is your heart clock ticking?
We love French fries. G3 looks the same, but each makes a difference for your health. This large fry at a typical fast food restaurant has 500 calories and 25 grams of fat. This small fry has 230 calories and 12 grams of fat. This fry comes from the grocery stores, 160 calories and 6 grams of fat. So, which do you choose? Because remember, time waits for no one. Welcome back. We just met Mary Beth. We found out that she had the diagnosis about 3 months ago, and what she went through to get to the point of getting the diagnosis and the treatment. And now it's my pleasure to welcome to the show Linda Blackburn, and who is surviving the 6 years of non-Hodgkin lymphoma, and she's doing great, and she's going to tell us her story.
Yes.
Welcome on the show, Linda.
Good, thank you. Thank you for having me.
Thank you. So tell me about the first time when they came to you and they told you that you have non-Hodgkin lymphoma. How did you feel? What was your reaction at the time?
Well, shocked, of course, because as Mary Beth said, there aren't a lot of symptoms for the kind that I have. You know, sometimes you might have a lump. That wasn't the case of all. Mine was found through a mammogram. And thank God that I did get my mammograms every year, because the lymph nodes under the arms did show up suspiciously. So meeting with my oncologist, Dr. Ritter, I think I'll never forget, it was me, my husband, and my daughter. And first thing, we went to the office, and he said exactly what type of lymphoma that I had, and he said, your prognosis is 7 to 9 years. And I remember looking at him and saying, doesn't work for me, not gonna work. And I think from that point on, that was my attitude, that I'm gonna fight it, beat it, win, and grow old. And so that's been my thinking behind it, and I've tackled it and You know, one of the things that I remember the most is the role that the oncology nurses played. They get to be your friends.
Absolutely.
And to this day, when you walk in to the office, now it's just once a year, but to see those nurses and they still remember you and say, oh, we're so happy to see you, how are you doing? And they just play such a big role in that process.
They are playing the role of angel the way they call them.
They are.
No question about it. The nurses, especially in that kind of field, without them being as nice and as scary for the patients, I mean, definitely, probably it's not going to. Now, after the diagnosis, and you went through the acute phase of treatment, and now for 6 years, I have no doubt that you have a regular follow-up to maintain that, hopefully, recovery and fighting that disease. So can you tell us the process?
Yeah. The first year, it was every 3 months. You would go, you get your blood work, get your CAT scan. After you get through that first year, then it's every 6 months. You go, you get your blood work, you get your CAT scan. I had a PET scan within that time frame. Now I just started, now I'm once a year, and that year is coming up in April, and I'll get to sit down with Dr. Ritter, and he'll tell me how fabulous I'm doing.
That's good.
And we'll start chit-chatting about the kids and be able to move on from there.
How about the family support, the community support? I mean, I have no doubt without the family influence in your management and treatment, I mean, probably it would be very hard to survive something like that. So how can you tell us something about
my family, I would say especially my daughter, she was pretty much my rock going through this. I remember her buying me books, buying me hand wipes. Take those with you wherever you go, and just diet was real important, and buying me the right groceries and getting into the right headset. And Lisa was very important in that, and the family, and my husband was great. He would bring me I had to have coffee. I just had this thing, I wanted coffee all the time. And he would have the coffee there. And even now, you know, it's still, you know, when that yearly appointment is on the horizon, you start to get nervous, and it's good just to have the family around, and they just say, you know, you'll be fine, you're fine, look at you, you're doing great.
That's good. I mean, our goal in the show is to put most of the patients who had that diagnosis or who will have the diagnosis in ease. What's your message to all of those patients?
It is to recognize that it's going to be a battle. It's not going to be easy. Hearing the words cancer, it's devastating.
Absolutely.
The initial words is devastating. But pick yourself up. And I think attitude is everything, faith. Just knowing that you have good doctors, good resources. I remember Northwest Ohio is an incredible place for medical treatment. They gave me options. You can go to Cleveland Clinic, you can go to UM, you can go to Ohio State. I'm going to stay right here because I know that I would get the care that I would get anywhere else. I can get it right here, and I can be home.
Sure, absolutely, absolutely. Thank you. I mean, that's a very good point. She mentioned the attitude, she mentioned the faith, she mentioned the will to fight this disease, at the same time the family and the community support. And as she mentioned, in this community in Northwest Ohio, we have good number of physicians, good medical centers, and we want to utilize it. And trust me, you are not getting less than any big centers, big names around the nation. We have a great centers, and we hope everybody will get the best treatment. Linda, we appreciate it so much.
Thank you.
And thank you for being on the show, and I hope you will smile forever the way you have this beautiful smile.
Thanks.
Thank you so much.
Okay.
And now I welcome Erin Parseghian, who is the director of the Leukemia Society.
Campaign director here in Toledo.
Thank you for coming here. And I want to introduce that despite our small community, we have an organization like that. And Erin is going to give us some information about this small organization in town.
Thank you. Yes, the mission of the Leukemia and Lymphoma Society is pretty simple. Our mission is to find cures for blood cancers, including leukemia, lymphoma, Hodgkin's disease, and myeloma. It also is to better the lives of our patients and their families.
So what can you provide the patient? I mean, I'm sure most of these patients, we know knowledge is so important in their treatment. You provide them with, you know, brochures, CDs. How do you educate those patients?
Yes, we have so many community education programs for patients as well as medical professionals. We also have copay assistance programs. We have patient financial aid programs where regardless of your financial status, you can still receive a stipend every year. And then we also have innovative programs such as information specialists that are dedicated 24/7 via telephone, and they can answer any questions regardless if it's just how to cope, how treatments, different diagnosis, getting guidance on clinical trials that might be offered by your doctor. So we have a variety of resources that are available.
So where do you get your fund? I mean, how can you support this organization?
Well, it is a volunteer health organization, so it's mostly fundraising. So we have several different ways that we fundraise, as well as generous donations from the public or just any patients. But our biggest things are annual fundraisers.
And if some of the viewer want to commit himself for some donation, how can they reach you?
They can reach us on our website, which is lls.org, and you can just try to navigate to the Northern Ohio section, and you can reach myself or anyone in the Northern Ohio chapter. And like I said, with our fundraisers, we have two big ones that are in place. We have our Light the Night fundraiser that a lot of people in the community, we had over 2,500 walkers this last fall, and so it's people that are either affected by blood cancer, being a survivor, or have lost a loved one, or just they're supporting their loved one. And that has been running in the Toledo area for 12 years. So we've had a great success with that.
That's great, that's great. How is the relationship between your organization and the medical community itself?
Very good. Actually, we are very big into fundraising because what we do with the money is that we fund researchers. So we have researchers all over the country, and they apply for grants, and it's a very competitive process, but we give the money to those that we think are most likely to get a breakthrough in blood cancer treatment.
How is lymphoma treated? Depending on the type of cancer, how much it has spread, your age, the health status of the patients, and additional factors, treatment should be designed differently to each patient or each individual. But the goal is the same: to complete remission of disease to last for a long time. Common treatments include chemotherapy, which utilize chemicals to kill the cancer cells, and usually used to treat cancer that spread beyond the main location, and usually require multiple cycles of treatment. The second type of treatment is radiation treatment. It's using high energy rays to destroy the cancer, and usually used as a standard to shrink the size of tumors. The third type of treatment, it's a combination therapy sometimes if your oncologist chooses so. Remember that your oncologist is the best to decide what type of treatment you will get for your lymphoma. And remember, time waits for no one.